Hi, Assalamualaikum warahmatullahi wabarakatuh. So today I will present about knee injury. Before I start, I would like to introduce my group mate, which is Ahmad Khairul Hafiz bin Ahmad Kramali, Anis Nazifa binti Ahmad Saukat, Luqmanul Hakim bin Shahril Azam, Muhammad Sharizal bin Tahir, and me, Nur Hafiza binti Rosli. Anatomy of injury knee. The knee is one of the most common body part to be injured. Types of common knee injury include sprain, strain, bursity, dislocation, fractures, meniscus tear, and overuse injuries. Knee injuries are generally caused by twisting or bending force applied to the knee or a direct blow such as from sport, falls, or accident. The main signs and symptoms of knee injury are knee pain and swellings. As you can see at the picture, there are types of injury knee such as ACL, which is anterior cruciate ligament, PCL, posterior cruciate ligament, LCL, lateral collateral ligament, MCL, medial collateral ligament, and meniscus. Okay, for common of injury is medial meniscus tear. As you can see at the picture of someone who have medial meniscus injury. Okay, one of the common knee injury, medial meniscus is on inner side of the knee joint. As you can see that C1 that at between our joint. Each of the knee has C-shaped pieces of cartilage. Cartilage acts like cushion between the shin bone and thigh bone. Ortho meniscus caused by pain, swelling, and stiffness might feel blocked to knee motion and have trouble extending the knee full. If you have a meniscus, you can extending your knee like this, like fully, but you feel like this. Okay. Any activity that causes to forceful twist or rotate the knee, especially when putting the full weight on it, it can lead to torn meniscus.
Next is common of injuries for ACL sprain. So ACL is anterior cruciate ligament and in the knee joint and band of dense connective tissue, which causes from femur to the tibia. Then ACL injury occur during sports that involve sudden stop or changes in direction. For example, jumping and landing, soccer, basketball, football, and downhill skiing. And then people will hear a feel popping sensation in the knee when injury occurs, and then the knee may swell, feel unstable, and become too painful to bear weight.
So now I will explain a little bit about the LCL. So LCL is a band of tissue that placed on outside of our knee. This LCL connect our lower leg bone to our thigh bone. So this LCL is function to prevent our knee to bend outward in a way abnormally. So this LCL injury happen when the tissue are sprained or tear.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Luqmanul Hakim bin Shahril Azam, and now I will present a common of injuries, PCL injury. Firstly, what is PCL? PCL is posterior cruciate ligament. PCL injury happens for less often than those injury to knees, more vulnerable counterpart ACL. It means the people more often get ACL from PCL. Okay, now I will present a symptom of PCL. Firstly is pain. Pain is mean mild to moderate pain in the knee can cause a slight limp or difficulty walking. It means the pain can make people difficulty to walking. Secondly, swelling. It means knee swelling occurs rapidly within hours of the injury. And thirdly is instability. Your knee might feel loose as if it's going to give way. It means you can feel your knee. Okay, now I will go to the causes. Firstly, the causes is motor vehicle accidents. It means dashboard injury occurs when the drivers or passengers bend knee slam against the dashboard, pushing in the shin bone just below the knee and causing the posterior cruciate ligament to tear. Okay, and then secondly, contact sports. This means athletes in sport such as football and soccer can lead their posterior cruciate ligament when they fall on a bent knee with their foot pointed down. The shin bone hits the ground first and it moves backward, being being tackled when your knee is bent also can cause this injury. Then I will give to you the risk factor. The risk factor is being in a motor vehicle accident and participating in sports such as football and soccer are the most common risk factors for a PCL injury.
Assalamualaikum. Now I will explain about common of MCL injury. As you can see, MCL is a short form of medial collateral ligament. The function of MCL is controlling the sideway motion of your knee and brace against unusual movement. Next, MCL during activities that involving bending, twisting, and quick change of your direction. For example, when you are playing football and then you get tackled from other player, it may cause MCL. Okay, other example which is when you get hit from outside of your knee, it may cause MCL injury. Next is MCL injury. It's a sprain or tear to the medial collateral ligament. It may cause swelling and pain. Lastly is MCL located inside of your knee, as you can see the picture. So, like I said before, when you get hit from outside of your knee, your MCL or inside of your knee, the ligament will overstretch and may cause sprain or tear. That's all for me. Thank you.
Next, we move to the do and don'ts for knee injury. So, do first is do use rest, which is rest, ice, compression, and elevation for reduced inflammation. Second is try different temperatures for relief. Instead, use ice for first 48 to 72 hours. Third one is look into acupuncture. So this is form of traditional Chinese medicine to relieve pain. And the fourth one is do exercise regularly. Okay, cardio can strengthen the muscles. Tai Chi and yoga help with stiffness, and this is low impact exercise. Don't. So don't risk a fall. A fall can further damage your knee and lead to other serious injuries. Second is don't let impact harm your joints, means that running and jumping are considered as a high impact exercise. And the last one is don't rest too much. Good to get some rest, but too much time off can weaken the muscles and make the pain worse.
So for the equipment, we will use strapping tape, initial tape or K-tape, underwrap and scissor. So it depends on the technique or type of injury. You guys didn't have to use all of the equipment during the strapping.
Okay, first by using the underwrap, wrap at the bottom of the knee and make sure knee bends about 30 degree. Okay, and then by using the same underwrap, wrap at the top of the knee and make sure you don't wrap it tightly. Alright, okay, next by using the strapping tape, set anchors and strap at the bottom of the knee. and then cut. Okay, next strap at the top of the knee, and then cut. Alright, and then come from back of the inside of the knee and cross it over and cut. Okay, next is exactly the same one again across the top of the knee, set. Okay, and cut. Alright, next is you need to reverse from front position. Okay, set and cut. Okay, the final one going to come in that direction. Then you set and cut. Press all down. Okay, and then repeat that, so you can put one over the bottom. Okay, and then one more at the top of the knee. Cut and press all down and done. Okay, for medial meniscus, start by using under wrap and then wrap the knee and make sure the knee bends about 30 degree and don't wrap it tightly. And then using strapping tape, set anchors and strap at the bottom of the knee and cut. Okay, next is strap at the top of the knee. Cut. Okay, next would be you need to make a tree and form a X. Okay, like that, and then across it and cut, set. Okay, and then you need to put some and then cut. Okay, next is you can add some more anchors at the bottom of the knee. Provide another anchor at the top of the knee. Fold this thing over and finish.
Okay, for medial meniscus, you need cut 3 pieces of kinesio tape, 1 long, 2 small, and make sure your knee are bent 90 degree. Find an anchor point. Then take 1 long kinesio tape and open it. Okay, after open, attach it with knot stretch there at bottom. And then contour around the knee and make sure you stretch the kinesio tape 100%. Like this. And then open one small kinesio tape. Find an anchor point and add 10% thread some of the tape. And attach it. Okay, next, read in half other small tape, bring it and cover over the area of the paint. Form an X, put quite a bit stretch on it and then lay down. Make sure there's not a ton of wrinkles in it good. So, like this.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Shariza bin Tahir and I'm from Arisar 2454A. So today I will show you guys on how to do strapping on LCL or lateral collateral ligament. Okay, first make sure the knee are bent 30 degrees. Second, make sure don't put pressure to the leg that we want to do a strapping. Third is wrap the tape at the above of the knee for one time. And then wrap at the below from the knee around the head of fibula for one time. And then we tap on the lateral ligament, which is straight and cross from below to the above strapping. Next, we do once again a straight cross tapping like a X shape. For the next step, we will do the second layer for the tapping to make sure it didn't easy to get removed when we do an activity. For the final step, just do a second layer strapping on above and the below strapping to make sure it didn't easy to get removed, and we will feel comfortable when we want to do an activity or want to do a movement with the knee. Make sure we don't strap too tight because it will disturb the blood flow. That's all from me. Thank you.
Okay, first, use a strapping tape to wrap the knee. Then apply the second tape at the same place. Make sure it tight. Then the second one, and then the third one. Make sure it tight, okay? Then lastly, the under wrap. Then finish. That's all for me. Thank you.
Assalamualaikum. So today I will show you how to apply kinesiology tape for knee injury, which is ACL. First, make sure your patient leg must be dry and clean. After that, cut 3 kinesiology tape in the I shape and cut the make the tape curve. First, position the leg 30 to 40 degree. After that, take the short one and stretch about 50% at the patella tendon. And take the second one, also place at the patella tendon without stretch, and stretch about 50% at the medial side. Use the last one and place on the patella tendon and stretch about 50% at the lateral side. Wrap the tape to make sure the glue is on. First, position the leg 30 to 40 degree. After that, use the long one and place on the medial side. After that, stretch about 50%. Make a curve. Second, we must do a cross between the pain. Stretch about 50%. And another one, also stretch 50% here. After that, wrap the tape to make sure the glue is on.